We've all seen by now the terrible pictures coming out of Ukraine this week of a maternity hospital shelled by Russian forces. It highlights more than ever the need for humanitarian help in a country being torn apart by war. Our first guest today is the Health Secretary, Sajid Javid. Thanks for joining us. And firstly, what medical help are we offering Ukraine?
Good morning. Thanks for having me on. We've been working very hard with our Ukrainian friends ever since the start of the conflict on humanitarian aid. So far, in terms of medical support, we've sent out 6 flights from the UK full of medical supplies and equipment and vital medicines and wound packages. We're coordinating also with our European friends to make sure that together we can provide everything that is needed. And of course, we will continue to do so over the coming 2 weeks or so. We would expect to send out many, many more flights.
Sajid, thanks for that. I'm sure people will be pleased to know what the government's doing to help. Can I just move you on to the subject of COVID? Obviously, thankfully, the government have relaxed all of the conditions. Better late than never as far as people like me are concerned, but it's very welcome nevertheless. I just wondered, from your perspective, how you felt that was going. And also, you know, given what's happened, do you think that if another pandemic struck, the government would be less likely to go for full-blown lockdowns and instead more focus on shielding the people who are most vulnerable and let people manage their own risk?
Yes, I do, Philip. And I think it's fair to say that we have collectively learned a lot through this pandemic. Of course, the pandemic itself is across the world. It's still raging. It's not over. So we need to remain on our guard. But as a country now, we are the most open country in Europe. People are getting on with their lives and like normal. And that's great to see. And in every respect, both socially and economically and in every other way. And we can do this because I think as a government, if we look back at recent decisions regarding the pandemic, we've made the right decisions. We were right to open up in the summer. Many countries did not do that. And we were right to focus on vaccines and antivirals and other treatments and also testing during the Omicron wave. And of course, as I said, we've got to remain vigilant. So we've got to have good surveillance. We've got to keep encouraging people to come forward for their vaccines if they haven't done so yet, because that protects not just them, but all of us. But we are in a very good position.
One thing that I've noticed, and I wondered if you'd comment on this, is that quite a few parts of the public sector appear to be bringing back in or not even getting rid of some of these COVID restrictions by the back door. So, for example, you know, if you go to a court, the court will say, you know, everybody there must wear a mask, even though the government guidance has been changed for the rest of the country. Is there any way that you can make sure that the public sector follow the government's lead and also what the government's now saying to the rest of the country?
Well, I can certainly speak for my part of the public sector, which is very large, obviously the health and social care sectors. So already we have removed in social care all the sort of restrictions that did exist before on visiting rights and other types of restrictions. Of course, we still want to make sure that there's testing available in social care. Older people in residential homes in particular are more vulnerable. In hospitals, there are certain tests either of staff and individuals we would do because people there are, again, more vulnerable. But a lot of the rules and regulations around this are either have been removed or gradually are being removed. And it's good to see. I think we all want to see a return to normal. I know for if I think about my youngest daughter at school, she's really pleased she doesn't have to wear a mask anymore like she did just a few weeks ago. And I think it's really important that throughout society that we start returning completely back to normal.
Sajid, the health budget has grown considerably over the last 10 years, and it's now bigger than the GDP of Greece. Is it going to continue to grow?
Well, that's that figure that you just, or that the way that you explained it, there, GDP of Greece bigger than that. That's something I put out there this week, deliberately so, because I made a speech earlier this week where I set out this the huge cost of our health service, and this was growing even before the pandemic, because thankfully, we're all living longer, but that means more pressure and challenges for the NHS. There's lots of new treatments, and we all want to have the very best from the NHS, rightly so, and that puts pressure. So a direct answer to your question, if we look ahead for the next few years, there are planned increases in the NHS budget, and that is necessary to deal with the challenges, certainly that the pandemic has left behind. You'll know, Esther, that the waiting list for electives is at 6 million. It will go higher before it falls because of the demand that is coming back of those people that stayed away. And it is right that we focus whatever we can on that. But it is also right that we together as a society understand that we can't keep having a health budget that keeps growing at double the rate of economic growth. That kind of growth is not sustainable for the long term. But we can deal with this in a very sensible way. And that's by focusing much more on prevention, much more on personalizing medicine and much more joined up, and also on performance of the NHS. For example, things like making the most of digital and data.
Sajid Javid, I want to thank you very much indeed for joining us this morning, and also a big thank you for stopping the mandatory vaccination requirements for NH staff and care workers as well. Thank you.
Thank you both. Thank you very much.